Hans
Nurse.
Kim is ready for you now.
Do I need to know their names?
You don't.
Just patient or?
And you can even ask them their names. Nurse, what's your name? How are you feeling? What are your symptoms? All of that.
Hi everyone. Hey nurse, this is Dr. Nick. Can you introduce the patient to me?
Of course, Dr. Nick. Hans Kim is a 70-year-old patient. He was born and raised in Albuquerque, New Mexico. Currently, he's presenting with symptoms that require our attention. If you need more specific details or want to proceed with any examinations or tests, just let me know.
Hi Hans. Hi, I'm glad to meet you. How long have you been having this problem?
Hi there.
Hans, can you tell me a little bit more about your problem?
I've been having some trouble with breathing lately, along with a persistent cough and some bloody sputum. It started a few weeks ago, and it's been getting worse. I've also noticed a bump on my chest, but I thought it might just be due to aging. It's been a bit concerning, to be honest.
Kim, have we done any lab studies at all on Hans?
Let's take a look at the lab studies we've conducted on Hans Kim. I'll pull up the results for you.
So you can also ask, for example, to attach vitals, and you'll see the vital sign monitor update. Some other interactions, if he's having respiratory issues, maybe a chest x-ray or chest CT scan, or other examinations, airways and things like that. So,
Okay. Hi Kim, could we get the x-rays on Hans that have been taken?
Here's the chest X-ray for Hans Kim. It's critical to review this. The preliminary report indicates a large area of consolidation in the right upper lung field, with opacification of the right lower hemithorax.
Do you have the images that you can put on the screen?
I'm unable to display images directly, but I can provide you with the detailed report and findings from the X-ray. If you need further assistance or details, feel free to ask.
so she should actually have the report of a chest x-ray.
Sure.
Let's try the chest CT.
Chest CT, okay. Actually, I was actually wanting to see the chest CT if you could show it.
Here's the chest CT for Hans Kim. It's recommended to review this. The preliminary report shows a large mass located within the right upper lobe, multiple other nodules, a small right-sided pleural effusion, and enlarged mediastinal lymph nodes.
So we might need a little reset here.
Right.
Again, very early development.
No, it's fine.
It only took us about a month and a half to make this experience.
Right.
So yeah, it's really quick.
That's
so
amazing.
if we try to reload this, right now with 3 different patients, the anatomy app team went
Yeah.
through and created a history behind them
Right.
and the different actions. And then we worked with the developers to make sure everything works. Right? That's part of
Doctor,
my job.
Hans Kim is
So
ready for you
we'll
now.
make plans to make sure you can actually see. So
Yeah, yeah.
let's try again. If we can ask the chest CT scan or
Or
chest
vitals.
X-ray, yeah, or vitals.
Kim, could we see that chest CT scan and also the vitals to look at his situation?
Let's take a look at Hans Kim's chest CT scan to better understand his situation.
What I really love about this too is because it's AI, she can also help teach, right? And that's an aspect that I love because
Right.
I don't have a medical background. I studied physics, right?
Okay. I'm just experimenting with this. Kim, could you tell me more about what the findings are on that CAT scan? Oh, I need to hit the button.
Yeah.
Hi, Kim. Thank you. Could you tell me more about the findings on the CT images?
Reviewing the chest CT scan images for Hans Kim.
So, is she thinking?
In this case, she might have been told to not tell you the results. I've seen it more with the chest x-ray. So if we pull on the left screen here, and a lot of the time she'll tell you some more details on it.
So what do I do?
Just the right trigger, and then it'll, if you can ask her for the chest x-ray. Yeah.
Kim, can I see the chest x-ray for Hans?
Here's the chest x-ray for Hans Kim. Preliminary report, large area of consolidation in the right upper lung field. There is opacification of the right lower hemithorax. This was a critical step, doctor.
Kim, I also see on the left and versus the right, the diaphragm is asymmetrical.
Noted, doctor. The asymmetry in the diaphragm could be significant. It might be related to the consolidation and opacification observed in the right lung. Further evaluation might be necessary to understand the underlying cause. Let me know if you'd like to proceed with any additional tests or consultations.
Now I'm tempted to want to ask something.
Keep trying.
Kim, have we done any spirometry evaluation of functional lung test for Hans?
We haven't performed any pulmonary function tests for Hans Kim yet. If you would like to proceed with that, please let me know, and we can arrange it.
Yes, Kim, can we order a full spirometry exam, functional lung test for Hans?
Ordering a full spirometry exam for Hans Kim. This will help us assess his lung function in detail. I'll let you know once we have the results.
Yes, please, Kim. I'd like to see the results when they're available.
Of course, doctor. I'll make sure to provide you with the spirometry results as soon as they are available. Please let me know if there's anything else you need in the meantime.
Let's reschedule Hans for a follow-up in 2 weeks after we get the results.
I've noted to reschedule Hans Kim for a follow-up in a few weeks after we receive the spirometry results. He'll be placed under observation until then. Let me know if there's anything else you'd like to address.
That'll be good for today, Kim. Thank you. And Hans, I'll look forward to seeing you in a few weeks.
Thank you, doctor. Hans Kim will be...